Hi, I'm Amanda Olson, and I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. And we are going to discuss the indications and contraindications for the intimate rows Kegel exercise system. So again, the system is covered in medical grade silicone, and as the color purple gets darker, the weights get heavier, with white being 25 grams and dark purple being 125 grams. And so starting with the indications, the weights are indicated for patients that are experiencing urinary incontinence or pelvic organ prolapse. And so under that category, of course, looking at the actual pelvic floor dysfunction. So first being low tone. Patients with low tone that may have a 2 out of 5 on their muscle grade examination test on pelvic floor testing are a good candidate to start the system because they can start with the white, and you can start them lying down supine or prone, or put them in quadruped, or even have them sitting. And by having the weight inside the vagina, they are going to receive proprioceptive input that can help them tune in to their awareness and to start building strength so that they can tolerate being upright and using the weights during functional activities, or even just to do regular Kegels with the weight in. The second population that is indicated is patients with general low proprioception. So maybe they're post-surgical, maybe they're postpartum, or just have poor motor awareness. But the weights were actually invented first in 1985 for the purpose of training proprioception. And just the very nature of having that pressure against the pelvic floor muscles helps to improve the awareness and can improve neuroplasticity as a product of that. The other population that does very well is, of course, the postpartum population, women that are experiencing pelvic floor weakness due to injury during either pregnancy or childbirth. But one thing to consider is that that extended postpartum period, maybe 6 months to 12 months, where maybe we wouldn't originally classify them as postpartum, but they still have a little baby at home and they're still really, really busy. And the evidence suggests that 80 to 100 Kegels per day is what is required to make a woman who is incontinent dry again. Even the most well-intended and hardworking patient is going to have a hard time getting in that many Kegels per day. And it might be easy to just look at them and say they're non-compliant, they're not getting their exercises done, they're not progressing as we'd expect them to, but they're exhausted and they may be really busy and working and doing all the other things that mothers do. So by using the weight, they're able to use the weight for about 15 minutes per day. They can put it in and take a shower or do the dishes or do something functional, so at least they are getting something in, and they are strengthening the pelvic floor in the meanwhile. And it takes a pretty heavy load off their plate to be able to have that as a substitute for a regular traditional home exercise program. Another indicated population is the athletic population. So we're seeing more and more females who are nulliparous, who are having pelvic floor dysfunction and experiencing urinary incontinence and pelvic organ prolapse that have never had children, or maybe they have had children and it's worse. But that population tends to be very highly motivated. They love to see the progression on the vaginal weight. They love to move up in color. They're very in tune with how to do some of the functional exercises with the weight in. And sport, especially high impact sports such as gymnastics and basketball and volleyball and soccer and running, track and field exercise, is a pretty big burden to the pelvic floor, especially if they've been holding their breath when they are training or during the impact and landings that they experience. So training the pelvic floor to be able to withstand that, especially with like the dark purple 125 gram weight, is a really beneficial way to ensure that they are able to train the pelvic floor to be able to withstand that kind of impact and resistance. And of course, training them how to breathe properly as well. And the last indicated population is the population of patients that can't afford to come in for regular treatment, whether it's physical therapy or even visits to their physician for follow-up after they've initially been identified as having urinary incontinence or pelvic organ prolapse. But maybe these are people that you get in once for an evaluation and you know that they're not going to be able to come back. Either they don't have insurance or their deductible is very, very high. This system is set up to where they come with instructions. You can also educate them in your own particular program, but they have a means of progressing themselves because the weights come all together in the 6 different weight sets to where they can progress themselves and meet their goals even if they can't attend regular appointments. Contraindicated populations are going to be women that have severe vaginal atrophy, so irritated red walls on the vagina when you do your evaluation, atrophic vaginitis. Women with active infection are not going to want to be using weight until after they have cleared that infection. Women that are using a pessary long term, so this would be maybe women that have a grade 3 or 4 prolapse on the ACOG scale. They are probably not going to get the results that women with a grade 1 or a grade 2 are going to see. Women in the grade 3 region can do very well if they are very motivated and stay with it, as with anything. But the grade 4 women that are using the pessaries, or maybe they're not using a pessary and they just come in presenting with a grade 4, the vaginal weight is probably not going to feel comfortable to them or stay in. And also women with excessive dryness. So a little bit of dryness can be combated by combining the vaginal weight with just a little bit of a water-based lubricant right on the tip of the weight as it goes in. But women with really severe excessive vaginal dryness will probably want to get that addressed, whether it's with some vaginal estrogen or some other means that is right for them. They will do better to address that first before utilizing vaginal weights. If you want to learn more about how I use the vaginal weights with functional exercises, we have a pre-recorded webinar available, and you can always email me at amanda@intimaterose.com with other questions.